pneumonia, studied previous medicine diet, and part of tenderness. I was totally muscle and I was what? So my patient me 7 to 9 years of age. With chief complaints of abdominal pain for 3 years and for 2 days and vomiting for 2 days. As we got admitted in Plasmodic Children's Hospital on March 14, we received complaints of abdominal pain, vomiting, and fever. After thorough investigations like blood test, CT, emerging studies like CT, the doctor diagnosed the patient as acute appendicitis. Now he is under treatment and recovering medications such as paracetamol, 10 mg, and injections cortisol, 350 and metronidazole for IV. There is no harm medical history, and there is a present surgical for appendectomy, which was underwent on March 20, and he is under observation for 2 days. And currently, the post-operative day is through, and now he is stable with no post-operative complications. Family history is he father and mother and had one little sister, and there is a family medical history, but there is no significant history of process or no hereditary average millimeters of hypertension. He got immunized after the age of 5 years, and the personal history is he maintains proper oral hygiene and body. He is both vegetarian and non-vegetarian, and he can take per days and harvest daily. And he has no any allergic reactions to all medications. Socioeconomic status, he is living in urban area and has all the facilities like electrical supplies and water facilities, and has a closed drainage system. After through all the physical examinations, he had hyperthermia, 99.9 Fahrenheit, and dry leaf circulations, and due to appendicitis while doing deep palpation and right palpation, had pain at right lower abdomen through assessments, and having no bubble sounds at the region of right lower quadrant, and the presence of tenderness. After investigations like blood test, hemoglobin is normal and WBC count is slightly increased. Urea is slightly increased to 28.5, normal is 24, and platelet count is normal, RBC is normal. After imaging studies like CT, small calcium deposit of soft tissues is present attached to the large intestine, 4 mm. The diameter is 4 mm. Which is present at the right lower quadrant. Now this is condition. Acute appendicitis. Appendicitis is taken as inflammation or is the infection or inflammation in enlargement of the appendix that is attached to the large intestine. There are two types of appendicitis. Chronic and acute appendicitis. Acute appendicitis is with chronic. It leads to severe conditions as it had several treated with several weeks. The pattern disability is the primary causes of appendicitis or swelling of lymph nodes or due to any infections or inflammation. Then pattern disability of appendicitis or due to primary causes or due to any infections or inflammation, it will lead to rupturing of the lumen or lining of the abdomen. So it leads to appendicitis, causes necrosis or ischemia. Then the daily position you can give the positions to the baby like silently and making the leg to belly to manage and medications like antibiotics, the hormone and methanol. Then the treatment surgical removal of the chemotherapy. So if it is for to prevent any complications, so condition of the patient rarely provide like organectomy to the patient. Next, nursing diagnosis. Acute pain related to infection or inflammation as evidenced by intermittent crying of the baby or the patient and impaired related to this condition and risk for infection and deficient fluid volume as related to nausea, vomiting, or diarrhea as evidenced by dryness or sunken eyes of the patient. Next, anxiety related to disease condition as evidenced by facial expression or the pending surgery of the patient. Next, health education. We need to make sure patient to come for regular checkups after discharge and advise the patient to take medications as prescribed. Rarely frequency very important for this condition to prevent any complications. And medications also as concluded, we saw the patient pathophysiology and management of the condition. As we see, the patient started with the clinician of it and after the administration, with the field complaints of abdominal pain, fever, and also for the necessity for intermittent appendicitis. So, we started treatment. At the moment, we advise the patient to come for